Hello everyone. Today I have with me Dr. Udipta Ray. He's a specialist in GI and robotic surgery, and he is the only proctor in the whole of Eastern India to do robotic surgery in the GI segment. So I warmly welcome him to Twisted Truths. Hi doctor, how are you feeling today?
Hi, I'm honored to be part of your show. It's great to be here.
So we'll talk about a lot of things, and I'm sure we'll be debunking a lot of myths that is there. We'll be talking about a lot of facts. But before we get started on this, why don't you talk about your journey over the years? What made you come into this field? What did you choose that you want to be a doctor, or is it that पहले जैसे होता था कि मम्मी पापा बोलते थे नहीं बेटा डॉक्टर बनेगा? So कैसे हुआ? How did you start?
Let me confess. So when I started off, when I was in school, when I made it through entrance, I had the option of becoming an engineer or a doctor, or even left to me. It may sound a bit difficult. I also thought of becoming a journalist.
Wow.
So
it might have been that you'd have been here. Yeah.
Could be. But I think you make the better choice.
Oh, really? Thank you. Thank you so much.
So basically, I chose on to medicine. Initially, the taste was very difficult because when you go to the dissection rooms and you come to dissect the dead bodies and you come to explore anatomy, okay, fine, that really gives you a thrill. But you need to read a lot, and you need to, becoming a doctor is really a test of memory game.
Right.
You need to memorize a lot. So I used to feel a bit taken aback because I was more into literature, more into physics, more into chemistry. And so I love science that way, more into maths.
Right.
So rather than mugging up biology.
Okay.
But eventually, when I came to know what about the different disciplines, it was a thrill going ahead with surgery.
Okay.
Because it was not the blood, but it was the idea that the surgeons have a definitive cure for a disease. While physicians, yes, I always accept that medicine is the basic science. Any physician, any discipline should know medicine well. But for a surgeon, most of the diseases are quote unquote curable.
Obviously, yes.
It is not like diabetes, not like blood pressure that you take on medicines day in, day out.
Right.
But suppose you have an acute appendicitis, you run to a surgeon, and the surgery is done and you're cured.
You're cured, yeah, correct, yes.
So that appealed to me a lot. And eventually, when I went on to do more and more minimally invasive surgeries, so I felt the difference. And when I moved on to robotics, well, that was a game changer. People used to ask me, well, doctor, did you really operate on me? Or my OT is still to happen, yet to happen. So that was the feeling, like people don't feel the pain of a big surgery. They get back to life. And even, I had few days back, I had someone come up, and I won't name her. She's a performing artist. She has a show 3 days down the line and she needs a surgery to be done. And when she went on with robotic surgery and performed on stage, it was amazing, I tell you. And it was so gratifying for a surgeon that you find someone getting back to life so fast and do what it really needs to be done.
So, doctor, to give our viewers a little bit of context as to what is robotic surgery.
Well, this is the recent innovation in science, I should say. All that you know about minimally invasive surgery has been laparoscopy all these days.
Right.
But people call it microsurgery, People call it microsurgery. It's a misnomer to call it microsurgery because it is not done under a microscope.
Right.
So a new device, which is a much better innovation of a laparoscope, is essentially the surgical robot. It uses holes to get inside the body cavities.
Okay.
And through these holes, you insert the instruments. The telescope goes in. It sends you images, which are 3D images, like the way I see you. We have really 3D visions,
Right. Yes.
because we have two eyes, and two eyes produces two different images in the brain processes.
Right.
And that is how we can measure the depth of a picture.
Correct.
So similarly, a robotic telescope has two telescopes integrated inside. So basically, you have two images that gives you a 3D version. So it's like a 3D version, and you have a natural 10 times magnification with a provision of 4x. So you can get the magnification 40 times. Imagine. So that you can see a small vessel and the RBCs passing through the vessels. So that is the kind of precision that you can achieve. And that too, and the best and most interesting part is that these holes, by a special technology, are painless.
Okay.
That is a game changer. Well, laparoscopy, I tell you, to be very honest, carries very little pain, but it's still painful.
Okay.
And the pain stays for some time. It takes some time. And it carries some risk of hernia. So robot is free of all these problems. And what was amazing, when you look at my hand, how far my hands can move. It can move this far in this direction. If you flip it across, very little movement, and still when you do it, there's very little movement sidewise.
Right.
But when it comes to robotic instruments, they can move in all directions like this.
Okay.
So there are 7 degrees of movement, and that too all around. So you have versatile hands. So it's like your hands are very versatile. You can see things up to 40 times big, and you have very good precision, very good control, because there's no tremor. Human hands can always have tremors.
Obviously, yeah.
Every one of us, we do have tremors.
Yes.
If you come across photographs, you'll find that if you break them into series, small series, you'll find how much tremor we have.
Yeah.
So robotic tremor filtration, that is another thing. So your hands might have tremor, but robot is not going to have tremor. So you have the precision, you have the magnification, you have the versatility of instruments, and you have a painless outcome. So since you have so much of precision, you have better control of vessels. So it's bloodless. So you have a bloodless, painless surgical outcome. What more do you want?
Right. So like with humans, you can never be 100%.
Right.
With robotics, can you be 100%?
Well,
and I'm talking in terms of the success rate.
Yes. So far, if I look at the global picture, robot is the latest innovation around. So I won't call it 100%, but this is the best possible option you have. And especially in cancer surgeries, the principle of cancer surgeries is not only taking out the organ which is affected by cancer. You also need to clear all associated places where this cancer might have spread. So take out the glands, take out all the associated organs, adjacent places where you can anticipate the cancer might have spread. And that is what is known in medical parlance as clearance.
Okay.
So we are more concerned about clearance in cancer surgery. So here robot beats everyone else. Because you have magnification, you have so versatile instruments, and you can seal off vessels well. So you can achieve the best clearance possible. So the most precise, suppose I ask you to draw a line 1 centimeter. You'll draw it. But I tell you, if I am going to magnify it and put on a scale, it will be 1.001.
It will be. Absolutely right. Yeah.
Right.
Yeah.
But what you can do with a robot, if it is 1 centimeter, it will be 1 centimeter laser guided.
Correct. Yeah.
So that is one thing that can happen. And there are many other technologies, like suppose you are fixing somewhere on the roof, suppose you are working on the ceiling. if you are working, suppose you are doing a fresco like this. Well, uh, if you look at the frescoes of Michelangelo, they're just amazing,
Right.
in Sixtine Chapel. So if you are doing something like this, you imagine how difficult it can be. But suppose you have the image inverted. So it will be just like writing on paper, the way you are doing.
Yeah.
So the robot will get your image inverted and it will come to the floor. The roof is going to come to the floor.
Right.
So you can work so easily and with more precision. So that gives you the best possible outcome. I won't call it 100% because frontiers of science are always changing.
Correct. Yes.
So we are going more and more ahead with perfection. That is robot.
Right. So going back to your medical school days,
Yes.
Like we've seen in Munna Bhai MBBS, was there any incident like that where you're dissecting something first time, you're inside that and you have a body in front of you, and maybe your professor has asked you to dissect something or cut something, and maybe you or somebody of your batchmates or classmates, they have fainted?
Yes, it happened. Used to happen every time. Every time a new session of anatomy used to start. Those were the days when we used to get the dead bodies preserved, of course, the cadavers,
Right.
and we used to dissect on the cadavers to show the different structures.
Right.
So it used to happen that every time a new batch used to be formed, someone or the other used to just faint off the very first day, just at the sight. So of course, the sight of flesh, the sight of blood. There's no blood with cadavers. Let me correct myself. But the sight of flesh, the sight of skin being peeled off.
What about smell?
Of course, there's a very strong, pungent smell.
Right.
And I tell you, I used to do the dissections, but because I used to love anatomy, and it used to be so horribly smelly. Even it used to smell underneath my nails. Despite using gloves, you are dissecting corpse, and that too preserved in formalin for days together. And not only my gowns, my bunions even used to stink. So I used to smell all like a morgue. So people used to, when they used to come by public transport back from the hospital, people used to stare at me, and this man must be coming out from a morgue, So it used to be all that smelly. But somehow or the other, our sense organs, of all the sense organs, our sense of smell is such that it gets desensitized.
Right.
Fastest.
Okay.
Suppose you are sitting on a smelly place for a very long time. You don't feel anything.
Feel the smell, yeah.
Someone walks in, will feel the smell.
Yeah.
But your sense of smell gets desensitized.
Right.
So we got desensitized to it. It was a natural course.
Right.
So, but for people around, it was to be very smelly.
Right. So doctor, in today's time, according to you, what is the most common cause of colon and GI cancer?
Well, if I think of colon and GI cancers, and for that purpose, most of the cancers happen on a background of genetic problems.
Okay.
And which are modified by environmental factors.
Okay.
So you have a background of genetic susceptibility, maybe, and you have some environmental factors.
Right.
So for colon cancer, if I think of all the causes, yes, genes come first, followed by diet and food habits.
Okay.
And environmental pollution adds on to it. And obesity, yes, adds on to it. There are certain genetic diseases where you have polyps. Polyps are nothing but grape-like things, grapes. inside the colon, which can turn into malignancies.
Right.
And some families, it runs in families. We call them familial polyposis. And other than genes and dietary factors, inflammatory bowel disease, ulcerative colitis, and Crohn's disease, these are inflammatory diseases of intestine. In the long run, can lead to cancers.
Okay.
And of diet, I should tell you, in particular, people who have a lot of meat and less of vegetable are more prone to develop cancers of the colon.
Okay.
In particular, stomach cancer also has many other issues, like you can have a small polyp, or there is a bacteria like Helicobacter pylori, which is common in our country, which is waterborne.
Okay.
And this bacterial infection of the stomach can lead to upper GI, like gastric and esophageal cancers. So, in general, if I put in a very small one liner, it is largely environmental pollution which changes the genetic structures or induces some changes, or you can influence susceptible genes so that you develop cancers.
Okay. Okay. And what about the gallbladder stones, and like how do they form? Because I think it is one of the most common problems. And what are the post-surgery effects?
Well, mm, how gallbladder stones is still a matter of research, I should say, tell you. But classically, it was said that there are three things that lead to gallstones. One is infection within the gallbladder. The second is you do not use gallbladder for a very, very long time. Suppose you are fasting for a very long time.
Okay.
And especially in women during pregnancy, it is not only fasting. People fast for a very long time. They are nauseated. They fast. But at the same time, you have some hormonal factors like progesterone, which keeps the gallbladder a bit sluggish, Okay. It remains stagnant. So the bile remains stagnant in the gallbladder for a pretty long time. And the salts inside the bile, they get deposited. Because, if you have a super saturated solution left to itself, what will happen? The crystals are going to settle down. That is how the muddy water settles down, and the mud is there. And eventually on the riverbed, so mud's laid down one after another in different layers, eventually lead to stones.
Right.
That is how all stones form.
Yes.
So that is one of the reasons. And the third important reason was some diseases which produce some breakdown of RBCs, like thalassemia and all.
Right.
But right now, it has become so rampant. And even children, 2 years, I tell you, 2 years, they are coming up with gallstone. So I wonder what is happening around. Because 1 year old, you cannot blame it on food habits. 2 year old,
correct.
You cannot blame it on food habits.
Correct.
These are just children, and how unfortunate these children are having gallstones. So basically, it has something to do with something more grave, maybe some environmental pollution, or maybe something more serious. So a lot of junkies have entered into our food habits, but at the same time, we should think the kind of water you are taking, demineralized water largely, the kind of pesticides that get into your body through the food stuff that you take.
Correct.
So otherwise, you cannot explain why a 2.5-year-old child should have stones without a definite genetic disease, without thalassemia or some blood disorders. So this is probably an effect of pollution around in different forms, maybe through food stuff, maybe through water, and maybe for factors we are yet to know. So gallstones have become an everyday problem almost every other household. And yes, surgery happens to be the definitive treatment. what happens after surgery? There are myths. People say that a gallbladder surgery, I have a gallstone. After gallbladder surgery, doctor, you say that the gallbladder together with the stone will be removed. What will happen to my digestion? Will my digestion go hayward? The simple answer to this question is that your digestion is going to improve because without a disease, the gallbladder would not have formed stones at all. So all these days you have been living with a diseased gallbladder, which was interfering with your digestion rather than contributing to it. And to be very frank, gallbladder contributes to some synchronized release of bile with food, which contributes to only 40% of the bile release for a normal functioning gallbladder.
Right.
So the rest of bile is continuously released in your intestine. When the gallbladder is removed, you have to change your food habit a bit.
Okay.
Since the release of bile is continuous, you have to keep munching. Every 2 or 3 hours, you have to keep munching so that the bile gets utilized.
Okay.
So this is the smallest modification that will give you a good quality of health, a digestive health, not only for galls after surgery, for days even without surgery.
Right.
That is the way you should think of having food. So immediately after surgery, we advocate that you pick up this new habit so that you never have digestive issues.
Right. And what are the causes, management, and the recurrence of hernia?
Well, hernia once again is another disease which is rampant. And if we think it that way, what is a hernia? Hernia is protrusion of an organ through an abdominal opening in the wall of the cavity which contains that organ. Well, to put it very simple, you have a weakness at the belly button. And the intestine tends to protrude out through the belly button. You'll have a swelling, you'll have a bulge there. For all males, we all around, we have a definitive, relatively weaker area at the groins. So there is a possibility of having hernia through that weak area,
right,
where organs from inside the tummy can protrude out. So that is a hernia. Some hernias you can see externally. Suppose you have it in belly button, you have a groin, you have it after a surgery where there's weakness of the muscles, you can see it. So these are external variants of hernia. There are internal variants as well. Like the stomach goes in through the diaphragm into the chest. So that is a hiatus hernia, we call it. Suppose there is a defect in the diaphragm. Diaphragm is the muscle which separates the chest and the abdomen.
Right.
Suppose there is a defect in the diaphragm and intra-abdominal organs like colon, stomach, everything goes into the chest through that defect. I remember a 10-year-old child presenting with a lot of respiratory distress, and he was diagnosed years back. It was years back when it was the beginning of my career, and a chest X-ray showed that the stomach and all intestine, they're all in the chest.
What?
Yes.
How is that possible?
So that was because of a developmental defect in the diaphragm. There's a rent in the diaphragm through which everything went in, and the lung was collapsed. So they put pressure on the lung, and the lung got collapsed, and that is the reason for which that child had a respiratory problem. The child came with a respiratory problem. So quite naturally, what happens? The first line investigation is a chest X-ray, to be very specific.
Yeah.
Very usual thing that anyone will advise. So the chest X-ray showed that the stomach is in the chest. So the diagnosis was a diaphragmatic hernia. So this is something that is an example of a hernia again.
Right.
You know. So this is what is hernia. So usually you have such things which are protrusions. They appear as bulges. They can appear spontaneously or due to strains, like you have chronic cough and something like that. You can develop it later, or even after surgery, suppose there is a weakness on the scar and bulges out, you have hernias. Usually, to start with, they're mere bulges, but can be painful, and you can have great complications as well. Suppose the intestine gets in and gets stuck there. So what happens? The pathway of passage, the passage of food stuff, gets blocked. You'll tend to puke a lot. Your tummy is going to get distended. You're not going to pass anything. So your bowel movements will stop altogether and you'll have excruciating pain. And that is what is an obstructed hernia.
Right.
So the danger of having hernia is an obstruction, or when if the obstruction stays for a long, the intestine can get gangrenous because it can compromise the blood flow to the intestine. So सड़ जाता है, जिसको कहते हैं ना सड़ जाता है. आप जब सड़ जाता है, what happens? There's gangrene of bowel, and that is a life-threatening situation because it leads to septicemia. पूरा जो बैक्टीरिया होते हैं ना, वो पूरा बदन में फैल जाता है. So you will have a dissemination of infection. इन्फेक्शन पूरा बदन में फैल जाता है, उसको सेप्टिसेमिया कहा जाता है. उसके बाद मल्टी ऑर्गन फेलियर में चले जाते हैं मरीज. So one organ stops failing after another. So that is a fatal outcome you can have.
Right.
So there lies the danger of having hernias. Yes, you once again, since it is a defect, there is no medicine that can give you a relief.
Right.
It's a defect. It's a hole. It's a defect. So you have to block the hole. You have to repair the hole.
Right.
So it is all about surgery again.
Okay.
So hernias, the one-point solution to all hernias is surgery.
Right.
Now, how will you do the surgery? Whether it's open surgery, whether it's laparoscopic surgery, whether it's robotic surgery, you have to tailor-made according to the patient's requirement. If you have a risky hernia at 80-year-old, suppose the patient someone who cannot undergo general anesthesia. Laparoscopy and robotic will both require general anesthesia. So what to do? So you have to offer a solution. Maybe open surgery under local anesthesia or spinal anesthesia.
Right.
Is a better option. Right. So there's no, I shouldn't say that treatment should be generalized. It should be individualized.
Right.
According to what you deserve, according to what is safest for you and best for you. Suppose I have a hernia and I know I need to get back to work as fast as possible. So I'll choose, if I don't have a lot of problems with my body, I'll choose a robotic surgery because that will give me a pain-free, fastest return to activities. So I'll choose like that. So it depends upon what are the other factors other than the disease itself. Suppose how good the heart and lungs are functioning and what are the risks. So a good risk-benefit ratio evaluation is the best way to determine what surgery suits whom.
Right.
So it is all tailor-made.
Right. And what about anal bleeding? Is it normal?
Of course, no bleeding through the anus is normal. And it is one of the very pertinent tissues, once again, very common thing to happen. And, to be very frank, we live in a society where still it is a male-dominated society, where there are a lot of inhibitions for the females to come up to doctors, especially when it comes to anal bleedings, things like that. People tend to suffer for years together. They cannot come out of the inhibitions to go out to a doctor, speak aloud, think about what to go ahead with. So a proper evaluation in time may save a lot of problems. It can be something which can be easily curable,
Right.
with a bit of lifestyle modifications.
Right.
Just prevention of constipation, good food habits, and you are done. But the problem lies with delay. And of course, it is important to get to a doctor and know that you are not having something very ominous. And you are speaking of colon cancer, right? Colon and rectal cancers also manifest with bleeding through the rectum. So it is important to get to a doctor, and no bleeding through the anus is ever normal.
Right. And how natural is farting? And do you think one should actually control it or reduce it?
Well, farting is just as natural as passing urine or drinking water.
Okay.
It is obvious, it is essential, and it is a marker of proper bowel activities. So the same route will be used for relieving gas as the route which is used for relieving stool. In our social lives, we know that we just to prevent embarrassment, we know how to control the noise and all with fart. But there's no way we can stop farting. Only that there's certain conditions where you tend to fart a lot. So people who tend to fart a lot, they have problems.
Right.
So that there's some food items which tend to produce a lot of gas.
Doctor, just in case, just to cut you once, when you say fart a lot, what do you mean by lot?
Well, it is subjective once again. So you mean to say what volume of fart is natural, right?
Yes, or what volume of fart is not natural, like
Yes.
either or.
Yes. So basically, having 20 farts a day is perfectly normal.
Okay.
So up to. So people can come up to you and say that I keep farting all the day. So we cannot measure the amount of gas that is being expelled out. But of course, if the frequency increases, quite naturally, we would like to presume that the volume is quite big. So there are certain conditions, you have certain food items. For example, I pick up one, beans, for example.
Right, yeah. Rajma jise.
Yes.
Or muli ke parathe.
Yeah, right. Absolutely. You hit it hard on the nail.
Right.
So these are notorious to produce a lot of gas. You know.
Okay.
So you tend to avoid these things.
Right.
You tend to space your meals well. That itself will take care. And there's some conditions where the bacteria tend to grow a lot inside the intestine. Nowadays, we call it small intestinal bacterial overgrowth.
Right.
And at the same time, people who are a bit nervous tend to gulp a lot of fluids, gulp a lot of air with every gulp. You know, if you take in water, at the same time, you are taking in some air also. Usually that air comes out as a burp. But for nervous people who tend to swallow a lot of saliva, you know, so they tend to keep having some gas intake every time. They tend to have some swallowing of saliva. And eventually, where will this go? It will go to contribute to more fat.
Right.
And the fat that is produced is essentially an index of bacterial activity.
Okay.
On what you are taking, the diet you are taking. A good amount of roughage will make sure that your bowels are clear.
Okay.
So you can prevent a lot of fat by keeping your bowels clear.
Right.
So amount of roughage, fruits in diet, they are the best solutions of having a lot of fat.
Right.
As also spacing, as I told you.
Right, doctor. Also, doctor, another cause of embarrassment is snoring.
Right.
So is it a disorder, or is it again very normal, like you said, as drinking water?
Well, there are many causes of snoring. Let us take it that way. Young people, suppose if you look at an adolescent, he nor of a normal build, he hardly ever snores. But suppose you're looking at a middle-aged person, snoring tends to develop with aging most of the time. Have you heard ever children snoring?
Well, I don't think so.
Infants? No, they don't snore. Anyway, some problems happen, like weight gain. The commonest problem around is weight gain. So obese people tend to snore. Some problems may be due to the airway passage of the nose and pharynx inside. There may be certain problems. And nowadays, we tend to recognize something known as obstructive sleep apnea. Largely, obese people suffer from this. And one of the major complaints is snoring aloud. Snoring to the extent that people next door are going to come up and say, please, please. So things like this, they need to be evaluated for obstructive sleep apnea. And there are many measures where you can minimize snoring. Well, small amount of noise which does not disturb sleep, does not disturb your own sleep, which does not leave you fatigued at the end, when you wake up from the sleep, is perfectly normal. Okay, but whenever it is a loud noise, you have to consider that you may be having something significant which needs to be evaluated. So more and more consciousness nowadays have led people to get evaluated for snoring itself.
Okay. And people say that eating after sunset is wrong. Although again, it's very difficult to adhere. But how true is this statement? And if I may add another question, when should be our first meal of the day and when should be our last meal of the day?
Well, the first thing to do in the morning is to load yourself with water.
As soon as you wake up.
Yes. Make sure that you load yourself with water. Have light bit of exercise. Well, if I say that Surya Namaskar, well, one simple exercise will keep you healthy. Okay. It is a good habit to rise early, of course. And the first meal of the day should be after a small bit of exercise. You have the first meal of the day. Maybe a small snacking to start with, but should be something healthy to start with. It is very wrong to skip an early morning meal because it affects not only your body, it affects your brain function. You're going to get dull if you skip a breakfast for day in, day out. So the earlier you can start off with a meal, maybe a healthy meal of, we used to have, in our childhood, we used to have chanas, with gur, with a bit of haldi. So that used to be some tradition. But I tell you, looking back these days, we found that scientific evidence that yes, having gur, a complex carbohydrate, having that is a part of energy giving procedure. Having chanas, which is once again a bit of protein, a bit of carbohydrate, together with haldi, which an immune booster. Well, that could have been one of the best breakfasts to start with. Bit of snacks, That is how we used to start our days, and maybe fruits. Some people used to start the days with fruits. And it's to say that you have the heaviest meal as a breakfast, and you have less at lunch, and you eat lightest at dinner.
Right.
So that is the way forward. So your dinner should be around 8:39 by IST. Indians should have that. Maybe you move around for one and a half hours after that. You take a short walk, maybe if you're inside, indoors, you just move around. And then if you are hungry, you can, just before going to bed, you can have a small snack, which is supper.
Right.
That is the ideal thing. So spacing the meals and making it so happen that you have the heaviest meal in the beginning, moderate in the afternoon, and almost like a pauper,
Right. Yeah.
They say that you have your breakfast like a king,
Yeah.
have your lunch like a prince, and have your dinner like a pauper.
Right. And if I have to ask you, like, 3 habits in general, which will keep you, with a good digestion, which will ensure that you have a good digestion. So what will?
First habit is that have a lot of fluids. If you don't have any restriction of fluids due to heart diseases or kidney diseases. Second is you have a good spacing of meals. And third is you do some regular bit of exercise.
Right.
These are the 3 habits which will keep your digestive.
And what are some of the food that makes our stomach very acidic? And you advise not to. Maybe again three examples that you can give.
Well, you have acid already. Our stomach contains hydrochloric acid.
Right.
So when you add acids, it's best to avoid aerated drinks, because aerated drinks will contain carbon dioxide and bicarbonate, and it will produce a lot of gas when they react with the hydrochloric acid in the stomach. So you take an aerated drink, you burp.
Yeah, exactly.
So because it has produced a lot of carbon dioxide.
Right. Just to cut you, doctor, like they say, no, ki when suppose if you're feeling acidic or you've eaten too much, drink a cold drink, it will come out. So what is that?
Well, you are creating more gas inside, and you are creating carbon dioxide, and you burp. Basically, that is what happens, but that is not something desirable. You better have a bit of neutralizing stuff, like a bit of curd.
Okay.
Bit of curd, we call it burani.
That should
follow a biryani.
Yes.
rather than
cold drinks.
Cold drinks.
Right.
So basically, eating habit is something. Another issue is having citrus fruits.
Okay.
So some people tend to have a lot of reflux with citrus fruits.
Exactly. Yeah.
So people who tend to have a lot of reflux would better avoid having citrus fruits.
Okay.
A lot of oil in diet. You have a lot of oil. You'll feel yourself that if you have a lot of oily food, you tend to keep yourself. You feel like you're full for hours together. Because stomach empties very slowly with oily food. So you try to curb on the oil content. Spices are not bad. Spices have been used for various purposes over ages. This time tested. That spices are not bad, because India is famous for spices.
Land of spices, this is.
Land of spices. So that is not bad. What is more harmful is that you have to choose about the cooking medium, the oil you are taking. And I tell you, after all these controversies regarding oil and all the literature, global literature, points down to the fact that ghee is perhaps the best possible oil to have.
Wow, I was about to ask you, how is ghee, and you've just answered my question.
Yes. Ghee, once again, is something that has a very good medicinal property as well, other than being a cooking medium. Bland oils like coconut oil, which have been time tested over ages, even for that purpose, mustard oil, which is also time tested for ages together, are perhaps better than most of the oils which are recently being propped up. But after all the researches, Globally, there are a lot of evidences to suggest that a traditional Indian diet, which contains a small katori of ghee, small bit of ghee, small bit of curd, a bit of sabji, bit of dal, bit of rice, bit of chapatis, small bit of papar, maybe some uh, pickle, and that is what structure of a traditional Indian diet was.
Yeah.
That is one of the best things to have.
Wow.
And we recommend fruits because they have a good GI index. They give you a sustained energy for a very long time.
Right.
So snacking with fruits is a very good habit.
Right.
I know it's difficult. I accept. It's difficult, but if you compare that way, if you have fruits as an option, if you tend to have maybe 2 or 3 small slices every couple of hours, you'll have a sustained energy. Firstly, secondly, it's a wonderful immune booster. And they're relatively lower in calories, most of them, except for some things which like mangoes, bit higher on calories.
But are they healthy? Are mangoes healthy?
Of course, because they're not only they're healthy for people who are not diabetic, of course.
Okay, right,
Of
right,
course.
right.
Otherwise, they're excellent as food items.
Okay.
Because there are a lot of yellow fruits and yellow roots have a lot of lot of vitamins, especially vitamin A, as you know.
Right.
These are fruits and roots will have a lot of vitamin A. They're rich in vitamin C.
Right.
And they're powerhouse of energy with vitamins and a lot of fibers.
Right.
So that they can give you a sustained, healthy life. If you sustain on fruits, they will give you a sustained energy for a long time.
Right. And we were talking about cold drinks, aerated drinks, energy drinks. Are these kind of drinks, can we have them once in a while?
Well,
and how rare or how frequent can we have
them? That is something that has never been. I haven't heard of this as how frequent you can have it, whether it's safe to have it.
Yeah.
And one word, it's not safe to have it. So leave aside the frequency and all. In one word, it's not safe to have it. But if you have it once in a while, it's okay.
Right.
Provided you don't have something like ulcer or something like that.
Mm-hmm.
If you have a diagnosed disease, better do not ever try it.
Right.
Because of the gas that they will produce inside, it can produce an ulcer to burst open.
Right.
If you have a stomach ulcer, no.
Right.
Never going for that.
Right. And does our sleeping habits impact our digestive health?
Well, they are very important. Our digestive health is governed by brain, right, to a large extent. Right. We call it gut-brain axis. And this brain also governs your sleep habits. Yes, indirectly, yes. If you have sleepless nights, you won't have good bowel movements, that's for sure. If you have, suppose the moment you go for a night shift, you'll notice the first thing that gets affected is your regular bowel habit. So it is directly related. And sleep, is a part of the rhythm, which is governed by many hormones, neurochemicals which are released in the body, like pineal gland, as I was telling. So that is a part of the circadian rhythm.
Right.
You're tuned to that.
Right.
The moment you break the barrier, you will have some disturbance over there.
Right.
That is natural to happen. So sleep, yes. Ask yourself 3 questions. Have I eaten well? Have I slept well? Have I done some exercise today or not? And if the answer to these questions is yes, you are on the right track, I tell you. And if you have to, break one misconception or one myth that we have about our health,
what would that be? The most common myth.
About our health.
About our health or about our food habits, maybe because it's related, or about our sleeping habits, anything, but which concerns the health directly.
Well, about our health, we presume that we are all healthy till we get sick. So, about our health, an annual health checkup for an adult is something that should be done.
Every year once.
Right.
Like a full body
A
health
full body health checkup, including dental checkup. Don't miss that
check.
out.
Yes, right.
People neglect dental checkup, but that is a part of good health. So, a full body annual checkup is a good thing to do for every adult, and especially after COVID. We are coming across younger people having sudden cardiac arrest and all these problems. So, it has become more pertinent, more pragmatic for younger people also to have an annual checkup.
Right.
About food, yes, one liner for food: be choosy, but don't delay.
Right.
Okay. So you choose your food, but do not fast for long.
Right.
That will keep your gut healthy.
Right. And what about alcohol?
In moderation, yes, it is very acceptable. And there have been a lot of controversies whether alcohol is good for health or not, and what is the recommendation. The recommendations keep changing. Wine as an appetizer, yes, it is acceptable that you have some 90 ml of wine in a week. Well, mind it, in a week. So basically, yeah, that these are the doses of alcohol that have been recommended for good health, but people don't adhere to it. Social intake of alcohol within very limited amounts, and that too occasional use, is acceptable. But let me be very true to you: even a single drop of alcohol inside the liver will produce some degree of fibrous tissue, some degree of destruction of normal liver. It may be very minuscule because liver is a tremendous reserve, but even a single drop of alcohol inside the liver will cause some 0.00001% small change in liver.
Oh my, amazing. Wow. So, doctor, I have few statements which we have heard, seen, read over the years. All you have to do is uh, tell us whether it is true or false.
Oh, rapid fire.
Kind of.
Okay.
Okay. Oh, before that, I had another question in mind for aspiring medical students. Okay, right after class 12, they want to go to the best of the best medical schools in India, and suppose they are zeroed down on two. Now, this is basis Cora, which I've asked you the question. If they have an option to choose AIMS, which is All India Institute of Medical Sciences, or they have an option to choose AFMC, which is Armed Forces Medical College, which one would you recommend and why? These are the two options given available.
Well, if you choose these two options, then every institute has certain specialty. It has its own merits and demerits. But as a centralized institute, AIMS is an edge better over all others.
Right.
Because you have an access to many disciplines, you come to know the different disciplines and the work in different disciplines, and so that you can choose your way forward.
Right.
So that you can pursue something higher studies to do.
Right.
So it is an edge better over all other institutes.
Right. Okay. So coming to the sentences, doctor, it takes years to digest chewing gum. True or false?
Well, you can never digest a chewing gum.
Oh,
So it will never get digested ever.
So I have to ask you this question, then where does it go?
So intestine, well, fine. Intestine has the natural propensity to expel it out. For digestion, you have to break down into smaller fragments, and then question of assimilation, absorption comes in. So the chewing gum goes out as such.
Right.
It does not stay in the tummy. It does not stay back in the intestine.
Right.
But whatever chewing gum you take, it is just going to go down in the loo.
Right. Apple cider vinegar, it cures digestive issues. True or false?
Once again, we are dealing with a myth. There is no one step cure to digestive issues. It is a good digestive habit, those which we have been discussing, which will help you. Eating habits help you.
Right.
Choosing the right meals help you. No one panacea for digestive issues.
One should poop every day.
Not really. Not really. It's the habit which varies from person to person and from regions also. So, having a poop every day is considered great in our country, but is a disaster for countries where they're shivering cold. So basically, if you have 3 poops in a week, it is considered natural.
Okay.
But individual habits vary.
Right.
So people here go crazy without pooping a day.
Right.
And people in UK are happy pooping twice a week.
Okay. You should drink 3 liters water every day.
I'll be more specific about that. Without any heart disease, without any restriction of fluid intake, you should take 1 liter of water for every 20 kg body weight.
Okay. Okay.
So 3 liters is not good enough for an 80 kg man. So it depends upon your body weight.
Okay. Okay.
1 liter for every 20 kg.
Right. Smoking helps you poop better.
Well, I should not promote smoking at any cost.
Right.
It doesn't really help you. You get to get a habit.
Right.
Because smoking gives you the nicotine, and intestine has the receptors which are stimulated by nicotine.
Right.
So it stimulates the bowel to move. But that is not the best way to get addicted to smoking.
Right.
So stay away from smoking. Develop a natural good habit.
Right. And the last one, the Indian chai, the proper doodh wali chai, is very good for your health.
If you look at chai, for example, if you look at the antioxidant property of tea, it is not what you add as an additive. It is said that if you wish to derive the benefit of tea, you have to take 10 cups of tea a day.
Okay. Okay.
So if you wish to take the antioxidant and other benefits of tea, the additive is up to your choice. Doesn't really matter. Whether you add a whitener, you add milk, or take it as raw tea, add on some masala to it,
or adrak ilaichi,
whatever, adrak, lychee, whatever. But the basic ingredient of tea doesn't alter with these.
Right. Okay.
The benefit you derive is from the number of tea sessions you have.
Understood. Right. Thank you so much, Doctor, for coming here and giving us your valuable insights, knowledge. I think this will be an eye-opener for a lot of people who will be watching this. It was an eye-opener for myself. I had a wonderful time talking to you, and it was a pleasure, Dr. Udipta Ray, having you here.
Thank you so much.
Thank you.